everyone, this is Dr. Priya Kalyam. I'm an oculofacial plastic surgeon in Dallas. What is cosmetic eyelid surgery? The eyelids are small but delicate structures integral to protecting and maintaining the health of the eye. A variety of problems can involve the eyelids, and oculofacial plastic surgeons are quite skilled in addressing these issues as they arise. As we age, the skin thins out and the tissue stretches and sags, and the soft tissue loses volume. As often, the first place of aging becomes apparent around the eyelids. Heavy upper eyelids, ptosis, may also interfere with vision, and if they do, insurance companies may often pay for the surgery. Loss of elasticity of the skin and sagging and baggy eyelids can also be treated. Lower eyelid surgery can help rejuvenate your appearance and is a common cosmetic and surgical procedure that we perform. It is the same as with upper eyelids as well. The goal of good surgery is to recreate youth, and the way to achieve that is by looking at the pictures of individual or patients when they were younger. Blepharoplasty is a surgery that is done to remove the excess skin around the eyelids. While we remove this excess eyelid skin, we have to be careful not to devolumize your eye, as that makes you look much older. If you looked at yourself when you were 14 years old, we often have full eyelids with tight skin. As we tighten the skin with eyelid surgery, we focus that we restore your youth that is appropriate for your anatomy. As we augment the tissues around the eye, sometimes we may move the fat from one area to another to help achieve a youthful look. How are the surgeries performed? The surgeries can be performed in our surgery center or in the office under local anesthesia, and they're completely safe to be performed in the office as they're relatively short duration and completely safe. Sometimes if patients are more anxious, we can take them to the operating room where general anesthesia is administered, where an anesthesiologist is going to monitor your breathing. After surgery, you go home with ointment along the eyelid. Sometimes there's stitches and sutures along the upper eyelid and the lower eyelid. You tend to expect a lot of swelling and bruising with eyelid surgery with very minimal pain. Majority of our patients only take Tylenol to control any discomfort around the eyes. If you experience severe bleeding or severe pain, you should contact our office immediately. The swelling is expected to get worse on day 2 and 3 after surgery, and we recommend that the patients apply an ice pack 20 minutes on and off to reduce the swelling that they may experience. After 2 days, we often recommend that the patients use a warm compress on the eyes for 5 to 10 minutes to allow the opening of capillaries and allow drainage of the fluid and the swelling that you have experienced from surgery. The patients come back to our office at 1 week and we remove all the sutures that were placed during surgery, and this does not hurt either. Majority of the bruising and the swelling resolves in about 2 to 3 weeks in majority of the patients. Some of the residual edema may resolve by 1 month. What is an ideal time to have surgery? This is a great question that a lot of my patients ask, because if you're going to have blepharoplasty surgery, you've got to give yourself at least a month. When we perform surgeries around the eyelids, it's very delicate and requires some careful care after surgery. 50% is what we do as surgeons, 50% is how you heal after the surgery. So it's important that you have time to heal from the surgery, although it is painless.